What are the main allergy testing methods? If you have ever wondered how doctors figure out what triggers allergies, you are in the right place. Let's break down the main allergy testing methods used today. Allergy testing helps identify specific substances, known as allergens, that cause allergic reactions. There are two primary categories of testing: skin testing and blood testing. Each method has its own techniques tailored to different situations. First, let's talk about skin testing methods. The skin prick test is the most common. During this test, small drops of allergen extracts are placed on the skin, usually on the forearm or back. The skin is then gently pricked, allowing the allergen to enter just below the surface. If you are allergic, a small raised, red, itchy bump will appear within about 15 to 20 minutes. This test is quick and can test multiple allergens at once. Next is the intradermal test. This method involves injecting a small amount of allergen just under the skin with a needle. It is more sensitive than the skin prick test and is often used when prick test results are negative but an allergy is still suspected. This test is commonly used for insect venom or penicillin allergies. Another skin testing method is the patch test. This test is primarily used to diagnose delayed allergic skin reactions, such as contact dermatitis. Allergens are applied to patches that are stuck to the skin, usually on the back or arm, and left in place for 48 hours. After this period, the skin is examined for reactions that may take several days to develop. This test does not use needles and is suitable for detecting allergies to metals, fragrances, and preservatives. Now, let's move on to blood testing methods. The specific immunoglobulin E blood test measures the level of immunoglobulin E antibodies in the blood that are specific to certain allergens. A blood sample is drawn and analyzed in a laboratory. This test is useful for patients who cannot undergo skin testing due to skin conditions, medication interference, or risk of severe reactions. Results typically take several days to weeks. There are also specialized food allergy blood tests that focus on identifying food allergens. These tests can complement skin tests or be used when skin testing is not possible. In some cases, challenge testing may be performed. This involves controlled exposure to an allergen, either by inhalation or ingestion, under medical supervision. It is considered the most definitive test but carries a higher risk of reaction and is done carefully in specialized settings. When considering these tests, skin tests provide rapid results and can test many allergens at once. However, certain medications, like antihistamines, may need to be stopped beforehand. Blood tests are unaffected by medications and are safer for people with specific skin conditions, but results take longer. Patch tests are specifically for delayed skin reactions rather than immediate allergies. The choice of test depends on the type of allergy suspected, the patient's health status, and clinical history. Understanding these methods helps allergists diagnose allergies accurately and develop effective management plans.